Hello everyone, this is Dr. Heather Austin Robillard, and this lecture video is to go over verbal and nonverbal behaviors in communication when you are clinically interviewing clients. As mentioned in previous lecture videos, we will talk about certain concepts that will be found in the ICRC licensing exam if you want to become an LCDC. For example, this lecture video will talk about best practices on the use of interviewing techniques, how to build trust and rapport with your clients, utilizing specific interview techniques, and how to assess verbal and nonverbal behavior of your clients. A very important part about assessment as well as treatment is building rapport with your clients. So we need to know how to foster rapport with our clients. One way to do this is through nonverbal behaviors. This can be eye contact, body language, facial expressions, and then we can also do it through our verbal behavior. How we can do this is our vocal qualities as well as what we say, so specific non-directive questioning, reflecting, summarizing, and we'll learn about the ADRS or ORS modality. I first want to talk about some of the nonverbal behaviors that were found in your Summers and Flanagan required reading. The first is attending behavior. This is eye contact, maybe leaning forward, certain facial expressions. This facilitates and inhibits spontaneous talk from client. So clients and individuals will look at your facial cues to let them know when it's their turn to speak or when they need to be quiet. Silence is another nonverbal technique that we can utilize. This puts pressure on the clients to share more. It also allows a cooling off time period and gives the clinician a time to consider their next response as well as the client. Of course, when it comes to nonverbal communication, there are some do's and don'ts. Listed in the reading, in your readings, it talked about several different types of nonverbal communication, as well as how it can be beneficial and how to not use it. One example is space. You want to be about an arm's length away from your client when you're interviewing them. You don't want to be too distant from them, and you don't want to be too close to make them uncomfortable. You want to move toward the client rather than moving away from them. Your posture should be relaxed but attentive, seated slightly towards the client. You don't want to be like slouching or super rigid or leaning away from them. Giving regular eye contact, we don't want to stare too much at them, and we also don't want to be absent or looking away or looking jittery. Our time, we want to respond at the first opportunity, but share our time with our client, so we don't want to be talking the entire time. You also don't want to be constantly like in a hurry rushing through all of the interview questions. Our feet and legs should not be too obtrusive or in the way, or we don't want to use them to keep distance between you and the client. Also, the furniture around you is important. It should be used to draw a person together rather than as a barrier. Like in my office, I don't have a table in between me and my clients. I think facial expressions are extremely important. You want to make sure that your facial expressions match another person's feelings. So you're not smiling when they're crying, or you're smiling when it's appropriate. You don't want to let your face not match your feelings, or have a scowl or kind of like a blank look on them. You want your facial expressions to be inviting. Gestures, try not to use gestures to compete with the attention of your words. So using your hands a lot can be really distracting, but you can use them to highlight what you're feeling, like, showing information while you're talking. Mannerisms, don't be too obtrusive or distracting. With your voice volume, want to make sure that it's clearly audible, not too loud, not too soft. But you can use your volume to try to help the clients mimic your softness. Your voice rate should be average, maybe even a bit slower to really enhance what you're saying. Don't sound impatient or go too slow or hesitant. Your energy level should be alert through a long conversation. You don't want to appear apathetic, sleepy, jumpy, or pushy. So again, some of the verbal behaviors and nonverbal behaviors can be helpful or unhelpful. So with empathy, it's unhelpful to frown, resulting from a lack of understanding them. It is helpful to have positive head nods, facial expressions that are congruent with the content of the conversation. With respect, it's not helpful to have nonverbal behaviors like mumbling or patronizing tone of voice, engaging in distracting behaviors like doodling. But it can be helpful to spend time with clients and be fully attentive. Warmth, we don't want to be apathetic or delay in our responding or be insincere. Fidgeting and signs of wanting to leave can be unhelpful as well. We want to be congruent between verbal and nonverbal behavior. Concreteness, shrugging our shoulders instead of asking for clarification, or vague gestures used to substitute for gestures, or words that carry specific meanings. So trying to use your verbiage. Drawing a diagram to clarify an abstract point can help be clear in enunciation. When it comes to self-disclosure, bragging gestures are not helpful. Points to self, covering eyes or mouth while talking, only when appropriate. So inviting self-disclosure if it's an important benefit. Immediacy, turning away or moving back when the immediacy enters the conversation, rather than using enthusiasm. Confrontation, never point your fingers or shaking your fists or tone of voice that communicates blame or condemnation. You want to use a natural tone of voice that's not accusing. So again, the Summers and Flanagan reading had verbal behaviors. For example, there's paraphrasing. This is when you reflect or paraphrase what you heard the client say. This assures the client that you heard them accurately and allows them to hear what they actually said. Clarification is, again, restating the client's message, typically followed by a closed questions like, did I have that right? Is that correct? Clarifies unclear client statements, as well as verifying the accuracy that the therapist heard them correctly. Reflection of feelings, restating a clearly stated emotion. So this enhances the client's experience of empathy, as well as encourages more emotional expression. Summarization, a brief review of several topics covered during the session. So this enhances the recall of the session content and ties it all together. It integrates themes that were also covered throughout the session. You can see examples of these in those recommended videos that we will be watching for this module. Also in the Summers and Flanagan reading, there are directive listening responses. So feeling validation should be used as statement that supports and affirms and improves validated feelings. This enhances and reduces anxiety temporarily, and it may cause the therapist to be seen as an expert. Interpretive reflection of feelings, the statement of the therapist's belief of underlying feelings of a client's thoughts and actions. Again, this can enhance empathy and encourage emotional exploration and insight for the client. Interpretation, this is a statement indicating what meaning the therapist believes a client's emotions are, as well as includes references to the past that the client has stated. Again, it encourages reflection and self-observation of the client's emotions, thoughts, and actions, and promotes client insight. Confrontation. Now, this can be a tricky one, but this statement points out a client's incongruity or discrepancy. It can be gentle or even harsh. So this again encourages the clients to examine themselves and their patterns of thinking and feeling, and may result in personal change. Immediacy is the statement that integrates the here and now using therapist disclosure that can be used for confrontation, support, or guidance. It initiates an examination of the here and now, focuses on how the client is affecting the therapist or how they are being perceived. An important modality that is used or comes out of the motivational interviewing technique is ADRS. It is evidence-based for helping clients move throughout their stages of change, which we'll talk more about throughout the semester. ADRS stands for open-ended questions, affirmations, reflection, and summarization. So open-ended questions cannot include yes or no answers, so they actually have to be more open. So for example, this can be like, tell me about your substance use, or what is your understanding of the problem? How would you like to be different? All of these include a broader answer rather than just being able to say yes or no or I don't know. Affirmations are genuine recognitions and validations of another person's strengths, values, and what they're going through. An example of this could be, "This is really hard to talk about here," or "Wow, that must be really important to you. I appreciate you telling me this." Reflection is conveying an understanding of what the person is saying. For example, "It sounds like you," or "On the other hand, you want to feel healthier, it sounds." Then there's summarization, organizing a collection of thoughts and ideas and offering it back, summarizing then the transition topic. So let me see if I got this right. "So you've been saying blank, is that correct? This is what I understand so far." A note when it comes to open-ended questions and reflections. In counseling, instructors would emphasize on open-ended questions as well as reflections. But we are not doing counseling. We are information gathering at this stage. So you have to learn when it's appropriate to use an open-ended question versus a closed-ended question. For some pros for open-ended questions, these typically make the client feel more comfortable, and the clients can discuss thoughts at a greater detail. However, the evaluator may lose control of the interview, which can be beneficial for the client because they may have more power, but it also can be detrimental. So with cons for closed-ended questions, this can make the client feel rushed or their feelings and perspectives not valued. The evaluator does have control of the information that's needed and are required. It reduces the client's ability to be spontaneous with their insight and might increase their passivity. But the client may feel relieved to just have yes or no questions. So one way that I kind of can utilize yes or no questions is, for example, let's say I say, "How often do you use drugs or alcohol?" which can be an open-ended question, but they may answer it with like, "Oh, not that much." So a vague answer. Then I can use a closed-ended question to get more specific. For example, "Oh, is it like every day or is it, once a month?" So then they have more options to kind of choose and they'll pick within that. When it comes to reflections, there are simple versus complex reflections. Simple reflections are just paraphrasing. It doesn't add any meaning to what the client said or a direction. The therapist just rephrases or rewords what they heard the client say. Whereas complex reflections move the client in a specific direction. It can highlight certain parts of what the client said as well as ask questions. This can be done in many forms, which we'll talk about. Here's an example of a simple reflection versus a complex reflection. So the client says, "I don't think I have a problem with drugs." A simple reflection would be, "Using drugs is not a problem for you." Whereas a complex reflection could be, "Your drug use is not something to be concerned about, so you aren't sure that coming here is going to be helpful for you." Another example is the client says, "I can see that I need to stop using crack, but smoking a joint now and then is no big deal." A simple reflection would be, "You don't see a problem with the cannabis." A complex reflection would be, "You're feeling like people don't understand that it's not the cannabis that's causing you all these problems, it's the crack use." Some of the ways that you can use complex reflections include amplification. This is reflecting with the client in an exaggerated way. This encourages the client to argue less. Coming alongside, using a bit of amplification to join with the client. Double sides, reflect both sides of the client's ambivalence. Using a metaphor, this paints a picture that clarifies the client's position. Shifting focus provides understanding of the client's situation and diffuses discord with them. Reframing puts the client's story in another way. Agreeing with a twist, this is often added to the reframe by prefacing it with a reflection that sides with what the client is saying. And then emphasizing personal choice allows you to reflect with the client's autonomy, control, and ability to make their own decisions. You can see the examples of utilizing these complex reflections in the required reading. I hope you enjoyed this lecture, and I look forward to seeing your interviewing skills.